with regard to sort of general treatments. Stem cell transplantation, whether that's bone marrow, cord blood, peripheral stem cell, it doesn't really matter what the source is. None of them really help orthopedic problems. There's some evidence that's been placed in the literature that if you have a really early bone marrow transplant to MPS 6, which, to be honest, we don't really do bone marrow transplants for MPS 6 anymore because we have enzyme replacement, but that it would, that they could actually maybe moderate their musculoskeletal findings. And actually this correlates with some animal studies that have been done in MPS 6 cats, where if you start their enzyme replacement therapy like from the day one that they're born, or at least early on, that they tend not to have the skeletal problems. So there may be something about MPS 6 that's different in terms of their response to enzyme therapy, but it has to be early. These are some growth charts of children who have had cord blood transplants in Duke, and boys are on the left, girls on the right, and you can see some of this. I just want you to notice that most of these kids are age 5 or 6 or younger, and so at least for the first 5 or 6 years, they tend to have a fairly normal growth trajectory. But you can see here that a lot of these children, if they're below these lines, are outside of the normal growth chart. So they're not all going to be a normal stature. And I think once they reach this age, they tend to start dropping off in terms of their ability to grow. We don't have that data anywhere in the literature. So what about enzyme replacement therapy? Well, again, there's data that shows that when you start enzyme replacement therapy, you can expect your child to grow, okay, faster than they've been growing. And maybe some of you have already seen this. It clearly reduces joint stiffness, decreases their fatigue, and whether that's from their muscles, their hearts, their lungs, it's not clear, but when we think about motion and musculoskeletal function, clearly you need your heart and your lungs to do that well. So overall, your fatigue is less. And again, this whole idea about reducing skeletal anomalies in cats. Now, this is only MPS 6 cats, and it's MPS 6 cats that started enzyme when they were basically newborns. And there's some information that suggests that it improves bone mineral density. Okay? And I don't talk much here about bone mineral density. It's a whole other subject. But if you guys have questions in the end, I'd be happy to talk about it. It's something that I'm currently, well, it's one of my other hats in life, is dealing with children with low bone mineral density. I think you can see the difference in this child's ability to hold his arms above his head. Okay, so this shows that joint range of motion is much improved. And this is kind of the literature. This is Dr. Cax's work with MPS 1 children. And it's a little counterintuitive. He charts joint restriction, so the joint restriction goes down, which means their motion goes up. So it's a little confusing, but you can see that they get better. It's well documented. Okay. Now, this is a study that we did in Seattle on boys with Hunter syndrome, and what you find is that if you look at there you go. Needless to say, the function of these boys, this is only 5 or 6 boys, and you can see on the chart the light blue is before they started enzyme replacement therapy, the dark blue is after enzyme replacement therapy. It's broken down by upper extremity function, transfers, and mobility, sports, and just sort of overall physical functioning, pain and comfort, happiness, and then global functioning, and all of them go up. And statistically, we can only prove that 3 of them did, but that's because we have a large difference. Some of the boys were wheelchair bound when they started and then could walk. Some of the boys were, they were in high school and mainstream in high school, but they got better too. So it's hard to show statistical differences when you have a broad range of affecting children, and it was a small number. But even with those small numbers and that large difference in the children, we were able to show that enzyme replacement therapy helped them all. So now I'm going to talk more specifically about the orthopedic deformities that we see and how we treat them. Okay? And so the term dysostosis multiplex is sort of a radiographic term that's been applied to the MPS disorders. And really just, if you break it down in Greek, it just means multiple bad bones. I'm going to talk to you about sort of the cervical spine, the lower spine, hips, knees, and hands. Okay? And again, please feel free to stop me anywhere along the way. All right? So first I'm going to start with the cervical spine. I've just tried to give you some idea here about with each MPS disorder how much you have to be worried about this particular area. Okay? And so there's two different things we talk about in cervical spine. And one is stenosis, which is narrowing of the spinal canal, versus instability, which is when the bones in the spinal cord and the vertebral bodies move inappropriately too much on each other. All right. So and I kind of throw them together here, and I probably need to better parse these out because they're two different issues, and actually some disorders have more of the instability problem, some have more of the stenosis or narrowing problem, and then there's a whole bunch that are somewhere in the middle, have a little bit of both. And so in terms of instability up in the upper cervical spine, there's a little peg that sits on one of the vertebral bodies called the odontoid process. Okay, and what that does is sort of holds the top two vertebral bodies from sliding back and forth. And because of the MPS problems, that piece starts out as cartilage when we're born in all and everyone, but its ability to turn into bone is delayed in the MPS disorder. So it's weak compared to someone who's not affected with an MPS disorder, and it actually can break. And when it breaks, then it starts to heal itself, and it doesn't necessarily break off all the way. It's sort of like a stress fracture kind of problem. And so then it just keeps getting beat up, and then it tries to scar itself in, and it grows and gets bigger. It gets what's called a fibrocartilage cap. Okay, and some people have called this the MPS cap. And I'll show you some MRIs of this. And sometimes it actually does break off all the way, and then the bones are allowed to move on each other inappropriately. So not only then do you have a narrow canal because you have this cap that's impinging on the spinal cord, but then the bones are moving on each other, and then that really knocks the spinal cord. Okay? So here is where I'm talking about stenosis. This is narrowing. Okay? I think you can all appreciate this hourglass appearance here. Okay? And then the cap is right here. Okay? Now, there are some individuals, particularly in MPS 6 and in attenuated MPS 1, and I just finally got a good MRI of this, but I just got it this week and I didn't get a chance to put it in my talk, where they have narrowing all the way down the spine. And that's a bit of a different problem. That's sort of a diffuse narrowing or diffuse stenosis, which is treated differently than an isolated stenosis at the top of the cervical spine. And usually that's because of dural thickening, but in MPS 6 specifically, if you look, these are the discs here, and they can bulge abnormally in MPS 6, and so then you get multi-level narrowing. And so this is cervical stenosis. And as Dr. Burton mentioned, they are doing some trials with intrathecal enzyme replacement therapy, and theoretically that would reduce the dural thickening. So we have some, So we don't have any evidence yet that this is going to be effective, but I think it's a reasonable idea and the appropriate candidate, and we'll have to go, so that information is still